Cardiac catheterization, angioplasty, stent, these are medical terms you may have heard about. But do you really know what they are? You should. One day, they will save your life. Taking the fear out of the heart catheterization, that is today on Time Waits for No One.
From Mercy St. Vincent Medical Center's Cath Lab, this is Time Waits for No One with Dr. Ameer Kabour, Chief Cardiologist and President of Toledo Cardiology Consultants. This is Time Waits for No One. Today, cardiac catheterization and angioplasty, medical procedures you will likely experience during your life. What are they? Why are they important? And what you can expect when your doctor says we're sending you to the cath lab. Plus, hear from a patient fresh from the procedure, on his way home with a new lease on life. Today on Time Waits for No One, sponsored in part by The Blade.
Hi, I'm Dr. Kabour. Today's in Time Waits for No One, we're going to concentrate on the heart catheterization procedure. Probably you heard about it. Many family members had it in the past, and everybody is talking about heart catheterization, the reasoning, the indication, the complication. But the most important thing, how to get the fear out of the mind of the people who are going to have the heart catheterization. This is a procedure which we do on regular basis, and most of the patients, they start thinking it's a risky procedure, it's a major procedure, but in reality it's not. Time to Wait for No One goal is educating the patient. Our goal is to give you the information from the beginning to the end of the procedure and teach you how the things done, not only about the heart catheterization, which is today we're going to talk about, but also about all of the procedure which we do in medical community, about some of the advanced medications we are going to use in our real life, and then we will concentrate on meeting with the expert and also with the people who are have enough knowledge about that issue to talk about the subject specific. So today we are talking about the heart catheterization, and we're going to talk to one of the patients who's going to have that procedure today. Let's walk in this room and talk to one of the patients about this procedure. Here we have Joe, who recently had an abnormal stress test, and for that reason we decided to do a heart catheterization. When we are looking about the indication of the heart catheterization, there is many. Chest pain, heart attack, but also on elective basis when the patient having some symptoms like trouble breathing, abnormal EKG, and they had a stress test which is subsequently lead to abnormal finding leading to the heart catheterization. So Joe here, when he comes in, basically the staff start working on him, interview him. They have all of the information about his name, his age, his family history, his previous medical history, decide about his allergies, his medications, and also be sure that he is ready and aware, and full information about the risk and benefit of the procedure was given to Joe. Hi, Joe.
Hi.
How are you?
Good.
After we talked to Joe in his room and we prepared him with all of the information needs to know about the heart catheterization, and we took all of the information which is necessary to make our procedure safer, we bring him to this heart catheterization lab. This is where most of the people fear to be. And really, it's a simple place. It's like an operating room. It has a lot of equipment. There's a lot of people involved in taking care of the patient in this place because we are confident and we want to be sure that the patient is going to be safe with good outcome toward the end of the procedure. So let me introduce you what do we have in the heart cath lab. As you can see, we have a table which is really the most important part of the heart catheterization, where the patient lie down and there is an X-ray machine on top of that, which is we move it and we rotate it. And that's what we call the C-arm. And that giving us the pictures, which is we watched on the screen. This is really where the cardiologists and the doctors are watching and making a decision based on all of those pictures. On top of that, as you can see, there's another monitor on the top, which is we monitor all of the vitals for the patient because that's also so important during the procedure. If we decide to do any more interventional procedure for the patient, like an angioplasty stent, there's a third monitor, which is going to be frozen picture to guide us and guide the cardiologist how to proceed with the wires and balloons and stents. In addition to that, we need to understand how the staff work. There's enough people to sedate the patient, so they give them enough medication so they will be relaxed. It's so important to prepare the patient with that so he will not be fearful, he will not be anxious, and that will lead also to a better success in the procedure. Also, there is people who are in the monitoring room, I will show you that later, where the people monitoring the vitals, they are monitoring the blood pressure, monitoring the pulse rate, and monitoring the rhythm, which is so important because, as we mentioned, there's possible complication we have to detect at the right time and deal with it at the right time. After the patient lie down on this table and feel comfortable, sedated, and everything is going the right way, we start the heart catheterization, which is we're going to show later how to proceed from the beginning to the end. But some of the catheter, just to give you an example, this is one of the catheter. This is the size of the catheter. As you can see in comparison to my finger, how small it is. This is what we put in the patient groin or arm when we proceed with the heart catheterization. This is where we inject the dye and subsequently take the picture for the coronary artery and identify the blockages if they have any, or if it's normal that the patient has no blockages, which is going to mean the end of the procedure. This catheter is flexible and easy to manipulate, and we have different shape and different form, which is depending on the anatomy the patient has, we use different catheter for them. One of the most important elements for the heart catheterization is monitoring the procedure, and that's where we have the monitor room where the staff monitoring all of the vitals, the pictures, the rhythm, and it's so important to have a team working together to have a better outcome for the procedure. When we come back, we'll meet in my office. I will show you how simple and easy is the heart catheterization. We'll take the fear out of your mind.
There are moments when we place our lives in someone else's hands. Moments of trust and faith. Moments of innovation, like conducting the region's first robotic surgeries. And moments of joy, like when Melissa could laugh with her girls again. The moments you know you're in expert, caring hands. These are the moments of mercy.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
Everyone loves their pizza. I do too. But here is a story. This one slice is 330 to 500 calories, 18 grams of fat, and 64% of your daily sodium intake. Next time, order thin crust, lots of veggie, and light on the cheese. This can make all the difference. Your heart will thank you.
Go to WTOL.com, Health Track.
Because time waits for no one.
A warm hunting cabin, a tent pitched on the lake, the Maumee River packed with fishermen. I'm Matt Markey, and this is My Outdoors. We'll look under the water in Lake Erie and in our many rivers and streams. We'll turn over a few rocks in the fossil park in Sylvania. We'll watch eagles nesting, hawks hunting, and ducks and geese filling the sky. There's no limit to what we can see and experience in the outdoors, and we'll investigate it all. I'm Matt Markey, Tuesday, Friday, and Sunday in the Blade.
New medicines, new procedures. The more complicated healthcare gets, the more you need a special kind of expert at your side. Sure, Mercy physicians are leaders in using the newest medical technology, but something just as important never changes. A commitment to listening, to understanding, to finding the best option for you. The choice to be in expert caring hands? Choose a Mercy physician. Find yours at mercyweb.org/doctors.
Welcome back. Now we are going to show you some exciting animation showing step-by-step the heart catheterization process, the heart disease process, so you will have a better understanding about everything we want you to know. The heart's main function is to pump blood to the rest of the body. To do this, it needs oxygen and nutrition for energy, just like other muscles. So it's important that the coronary arteries that bring blood to the heart muscle are not blocked. If you look into the arteries right now and try to understand the blockages buildup, and we always talk and educate you about the necessity of diet and exercise. So try to understand how is the blockages buildup. As you can see on the screen, the arteries are wide open and the blood is running very smoothly. There is some yellow particles, which is the bad cholesterol, and the red one are the platelet and red blood cells. And there is also a smaller brownish particle, which is really the good cholesterol. There's always a competition between the good and the bad cholesterol, leading to the future management of the heart disease. We want the bad cholesterol to be as low as possible, and we want the good cholesterol as high as possible. Why? Because the bad cholesterol, as you can see on the screen, it starts showing the buildup of the plaque, which is going to lead to a significant blockages. As you can see, the cholesterol LDL, the bad particles, start going inside the wall of the artery, and that will be the problem on the long run. Over the years, if you are a smoker, diabetic, high cholesterol, obese, all of that, you have a gene problem and your family, strong family history of coronary disease, you build up the plaque, and then you start having the platelet accumulating on top of that and building up a significant clot, could lead to a massive heart attack. As you can see on the screen, the clot growing and growing, and the plaque is building up more and more, and then that's when you have the heart attack. A cardiac catheterization, or heart cath, is a diagnostic procedure that provides a picture of the blood vessels of the heart by using X-ray dye and fluoroscopy, a type of X-ray movie. These blood vessels, called coronary arteries, supply the heart with oxygen and nutrition. Coronary artery disease, heart valve disease, heart failure, and congenital heart disease are some of the problems that can be diagnosed with a cardiac catheterization. To start the heart catheterization, a numbing medication will be given before the catheter is inserted in the groin area or in your arm area, depending on which procedure we are using. The catheter will be guided to the heart. Once it's in place, dye will be injected into the coronary arteries. Your doctor can see any blockage as the dye moves through these arteries. A series of X-ray images will be made using a circular X-ray tube and rotate around your body. The doctor will view these images on a TV-like monitor in front of him. Some people feel a flushing sensation during the procedure, metallic taste, headache. All of these could be a side effect of the dye injected in your heart. Now let me show you how is that done. As you can see on the monitor here, the heart catheterization is started with the sheath, and then the catheter introduced into that sheath, pushed into the femoral artery, going into the aorta, and then after that we reach to the heart, as you can see it in a second, where we engaging with the main arteries of the heart, and we start injecting the dye to identify the blockages in those arteries. As you can see on the screen, after we inject the dye in the arteries of the heart, we identify the blockages as you can see it. That blockage is a significant one, leading to abnormal stress tests, leading to the angina symptoms or chest pain, trouble breathing, all of those symptoms which could happen in coronary artery disease. During the heart catheterization, if we decide to treat this problem, usually we start by doing what we call a balloon angioplasty. As you can see in that animation, it's showing that the balloon put in the blocked area, and then after that we go through the wire, the same wire we advance the balloon, we go ahead and we put the stent, as you can see it in the screen. So the 3 steps of the management is to identify the blockage, treat it with the balloon first, and then after that with the stent, using a specific anticoagulation to make your blood thin enough during the procedure to have a better outcome on the long run. A pressure or a closure device may be used to seal the artery to prevent bleeding after taking out the catheter. You will be encouraged to drink water and other fluid to help flush the dye from your body. Generally, you will be asked to be flat on your back for about 2 hours if you receive the closure device, and about 8 hours if you receive the pressure manipulation of pulling out the catheter. Your doctor will describe the risk associated with the cardiac catheterization as it's shown on the screen. Possible risk may include bleeding, infection, damage to the blood vessel at the catheter insertion site, heart rhythm disturbances, chest pain. Stroke may also occur but are very uncommon. There may be other risks depending on your specific medical condition, and your doctor will explain it to you at the time. So physically, after we did that angioplasty stent, how do you feel?
I feel like a new man. I feel totally fine, like nothing's ever been wrong with me.
Ready to go and enjoy your life again?
Yes.
Good.
Again.
Good for you.
Yep.
A warm hunting cabin, a tent pitched on the lake, the Maumee River packed with fishermen. I'm Matt Markey, and this is my outdoors. We'll look under the water in Lake Erie and in our many rivers and streams. We'll turn over a few rocks in the fossil park in Sylvania. We'll watch eagles nesting, hawks hunting, and ducks and geese filling the sky. There's no limit to what we can see and experience in the outdoors, and we'll investigate it all. I'm Matt Markey, Tuesday, Friday, and Sunday in the Blade.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
For many women, eating too much salt plays a part in causing hypertension because salt makes you retain fluid. It bulks up the volume of blood flowing through your blood vessels. High blood pressure will increase your chance of stroke, heart attack, and kidney failure. Read those labels and watch your salt.
Go to WTOL.com, Health Track.
Because time waits for no one.
New medicines, new procedures. The more complicated healthcare gets, the more you need a special kind of expert at your side. Sure, Mercy physicians are leaders in using the newest medical technology, but something just as important never changes. A commitment to listening, to understanding, to finding the best option for you. The choice to be in expert caring hands? Choose a Mercy physician. Find yours at mercyweb.org/doctors.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
Getting men to change their lifestyle is leaving their wives and children very frustrated. Men seem to think that medication is the fix. It's like putting medications in the big cheeseburger and expecting to be healthy. Come on, guys, you can do it, one step at a time.
To learn more, go to WTOL.com, Health Track.
Because time waits for no one. So here we have Joe finished his procedure, had his heart catheterization, and we're going to ask him a few questions because, as we mentioned earlier, we want that fear about the heart catheterization to go away from the people. So Joe is just an example, and it's a real patient who is going to tell you his experience about how did the procedure go. Hi, Joe.
Hi.
So you had your heart cath.
Yes, I did.
I'm going to let you speak and tell us exactly how was it and how is everything went.
Okay, I came into the cath lab and there was 4 or 5 ladies that asked me a whole bunch of questions, slid me over on the bed, and the one lady told me, I'm going to give you something to relax you, and which it did. It relaxed me. And as I was laying there, I was getting relaxed, and then you came in and did the heart cath. And then after you did the heart cath, I laid there for a few more minutes, and they unhooked me and they took me out, and it probably lasted a half hour or less.
Did you have any chest pain during the procedure, any major symptoms?
No, I didn't feel a thing.
Because heart catheterization, when we do an angioplasty, the patient could experience some symptoms during the procedure. So we always ask the patient, how does he feel? Is there any chest pain, trouble breathing, confusion? We ask them sometimes to move their arms and their hands to be sure that they are not having any major complication from this procedure. So Joe, after he had the heart catheterization, we made a determination that he has a few blockages and he is going to require a stent. So did we talk to you Joe and told you that you're going to have a stent.
Yes, I was.
And you were already consented for that, that if there's
Right.
any blockages, we're going to proceed with a stent, right?
Correct, yes. Yes.
Now, after we are done, did we do any, I mean, did we put a sandbag on your groin and we told you you're going to stay
No,
lying down?
you put a plug in my groin, and then I went out to recovery, and they gave me some meds, and then I went back up to my room.
So within 1 hour, you're done.
Yeah.
You are able to walk and you're feeling good, no problem, no bleeding, no need.
Nope,
This is
nothing.
the advancement in the heart catheterization. Most of the patients, they used to be lying down on their back for about 8 to 10 hours. And it's really depends on how much pressure we put on the groin, and the complication of hematomas and bleeding was much higher than what we have these days with using these plugs, which is a simple procedure. We use it in most of the interventional procedure, and Joe is one of the example. The reason we are concerned about that because of the blood thinner. You know, when we do an angioplasty stent, we use a blood thinner, and that's one of the example here for Joe. Joe, how you feel right now about going home?
Great.
Good.
I'm ready to go. I've been ready.
Now, was it the procedure that fearful, that complicated? Were you concerned about it?
No.
Is that because you had it before? Was it like the first time, or it was a little
No.
bit different?
Because even the first time I had it, I wasn't too concerned about it.
Good.
Because I knew I was in great hands, so it made me feel good.
But other than being in great hand, is it because we informed you about what to expect and you got enough information about the
Yes.
procedure?
Yeah, everybody explained the procedure very well to me.
Good. And that's really our goal, is to educate everybody about heart catheterization and how we're going to do it, and to get that fear out of your mind.
New medicines, new procedures. The more complicated healthcare gets, the more you need a special kind of expert at your side. Sure, Mercy physicians are leaders in using the newest medical technology, but something just as important never changes. A commitment to listening, to understanding, to finding the best option for you. The choice to be in expert caring hands? Choose a Mercy physician. Find yours at mercyweb.org/doctors.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
Up to 8% of pregnant women get hypertension, which can be extremely dangerous for mom and baby. It's increasing as women are getting heavier and have babies later. Gestational hypertension usually happens after the 20th week, so work with your doctor to keep close watch of your blood pressure.
Go to WTOL.com Health Track.
Because time waits for no one.
A warm hunting cabin, a tent pitched on the lake, the Maumee River packed with fishermen. I'm Matt Markey, and this is my outdoors. We'll look under the water in Lake Erie and in our many rivers and streams. We'll turn over a few rocks in the fossil park in Sylvania. We'll watch eagles nesting, hawks hunting, and ducks and geese filling the sky. There's no limit to what we can see and experience in the outdoors, and we'll investigate it all. I'm Matt Markey, Tuesday, Friday, and Sunday in the Blade.
Welcome back. Now, I hope after all of this information we provided you, we took the fear out of your mind about the heart catheterization. As we explained, it's a simple procedure. It doesn't take that much. At the same time, your doctor usually confident to explain everything to you, how it's done from A to Z. You need to think about the heart catheterization is becoming a standard test to improve the outcome of patients, especially if it's needed. But the most important thing is the patient himself. You need to remember, if you start having symptoms, if you're having a chest pain, if you're having trouble breathing, shoulder pain, jaw pain, you need to talk to your family doctor who will be the captain to decide where to go from there. He should do the EKGs. He will order some testing for you, including stress test and echocardiogram and all of the tests which could help to decide about the future management for you. The bottom line, if your doctor tells you that you need a heart catheterization, don't be afraid. It's a simple procedure. All of the facilities which does this in our area are very equipped, very trained, and they are ready to do this procedure in a very easy way. I hope we took that fear out of your mind. Now, after we did the heart catheterization and we informed you about what we find, if you have some minimal blockages or a serious blockage, whatever is the treatment, it's going to be the most important step, how to prevent yourself from coming back to the cath lab. You need to remember, we always discuss it in some of the spots we introduced to you before about the diet. You don't have to eat cheeseburger and say that I have a cholesterol medicine in that pill. Do you remember that cheeseburger, we throw it in the garbage? That's one. When you are ordering your pizza, you need to order the one which is healthier, less calories, less cheese, order more veggie. It's so important to do that. The next step is to discuss with your doctor, for example, about your aspirin, how necessary to do the aspirin for every patient who is older than 55 years old age. The other thing is to remember about exercise. That's what we need to promote. Exercise is so important because it will help to keep your blood pressure under control, your cholesterol under control. At the same time, if you are diabetic, will bring it down. And the chance of having a heart problem in the people who exercise on a regular basis is much, much, much less. The bottom line, remember how to take care of yourself. Don't wait until you have the heart catheterization. You can prevent yourself from having a heart catheterization. So in that case, the fear will not enter your mind, period. Try to exercise, eat healthy, take care of yourself, take care of your mom, take care of your kids. That's really the most important thing. Thank you. This was the first premiere show for this program, and I hope you enjoyed it, and I hope we are in this journey together. Our goal is to educate you and prepare you to be aware of all of the problem and medical issues and go ready to your doctor to discuss it with him in a better understanding and a better informative way. In the next few shows, which is we're going to present in the next few months, we are going to talk about multiple medical issues, not only heart disease. We're going to talk about delivering baby. We are going to talk about infectious disease. But probably also we're going to concentrate on the most advanced technology in medicine. We're going to talk about doing the heart surgery without surgery. We're going to talk about robotic surgery. We're going to talk about treatment of new antibiotic and new cholesterol medication and new blood thinner, which is really going to improve our life together. Again, we go back and we hope that all of us follow the instruction and discuss it with our doctors. Because remember, I always say, time waits for no one.